Hi, Shireen. How are you?
Good. Nice to see you, Richard. How are
Not
you?
doing well, and nice to see you again. And thank you so much for taking the time to chat with me today. I'm really excited, and I feel like we have such a great rapport because we've had an opportunity to speak many times. So I really am excited to get into you and all things Ada Health today. But before we start, we are speaking with Shireen Saxena, who is the Vice President of External Affairs and the Chief of Staff at Ada Health. Is that correct, Shireen?
That is, and thanks so much for having me, Richard. I'm super excited to be here talking to you today on this Friday.
Thank you. Thank you. I am really interested in both your professional journey, but also in your personal journey. And I know folks listening will be as well, because so much of what you've experienced in your own sort of personal journey has really influenced the work that you were doing at Ada Health. And I think, like so many entrepreneurial folks like yourself, it always is something very personal that sort of leads to, driving the types of transformation that you're trying to drive at Ada Health. And I think you have such a unique perspective that you bring to Ada Health. So I'd love to hear a little bit about, you. To start, maybe you could just give us a little introduction to you, to the audience, and then I'd like to talk to you a little bit more about some of your journey towards the place that you are today at Ada Health.
Yeah, that sounds great. And happy to give you a bit of an intro from both the personal and the professional, because as you said, I mean, it's really hard to separate the two.
Hmm.
So I'm American. I was born in the US, but Indian origin and was raised in Italy, but currently living in Germany. So
You're like
the
the
reason
coolest person.
The reason why I start with that, and I swear it is relevant, is because it sounds like kind of being a little bit from everywhere, but
Yeah,
many times it's also felt like being from nowhere.
sure. Oh,
And
that's
so
interesting perspective. Yeah, that's interesting. Yeah.
yeah, and so I think, when you have that kind of complicated sort of identity, feeling seen at various points, in your life and whatever it is that you're doing is just so important, right? And
Mm.
I went to undergrad in the US, but I was in high school. I was in high school in Italy, and I always worked, as a volunteer in crisis operations. For some
Oh,
reason, this was something that I was very drawn
yeah.
to.
Why? Yeah, you were called to that. Yeah.
I was called to that. It was like
Interesting. Huh.
crisis, I'm there. So
I mean, that's remarkable in the sense that, there are many folks that run away from crisis, not run towards crisis.
yeah,
So,
and I think it's
yeah.
also important to be specific, like what kind of crisis I run toward and what kind
Sure.
of crisis I'm like, I can't be anywhere near that. But then there's a whole other set of people who are like, I need to be at exactly that crisis. And
Right.
thankfully, like we've got enough variety here in this world that we can try to cover all of it. But for me, the calling was really around mental health and
Okay.
women's health.
Hmm.
So I went to Barnard College, the women's college at Columbia University for
Oh,
undergrad.
sure. Yeah.
And I spent 4 years working on Columbia University's crisis hotline, which was operating from 10 p.m. to 3 a.m.
Wow.
Every day.
Wow.
And the mission was to get people through the night.
Right.
That was the only mission. It
Right.
was get them through the night to the next day, armed with the information that they needed.
Mm.
And at the same time, I was also a New York State Department of Health certified sexual assault and domestic violence
Counselor or yeah.
counselor.
Yeah. Yeah.
Yeah,
Yep.
and a lot of the emergency rooms in New York City. And kind of the same idea was show up to the emergency room when a sexual assault or domestic violence case had happened in the emergency room, and basically show up and be that person who is the central coordinator between police and clinical staff and potentially the family or partners that's shown up. And then, of course, most importantly, be the peer advocate for
Right.
the actual person in the emergency
Yeah.
room.
For the victim. Yeah. Yeah.
Yeah.
Yeah.
And, same thing there. It was making sure they had all the information that they needed to basically move on to the next day, whether it was here's the domestic violence shelter you need, or here's how you
Mm.
file a police report, or
Mm.
here's a safe place for you to stay. So That was basically where I started in undergrad. And from there, it was like, I just really, really need to be at the heart of women's health and mental health. And so,
Wow.
very quickly after that, after I graduated, I started working at Mount Sinai in clinical trials in the mood
Hmm.
and anxiety disorders program, specifically focused on PTSD and treatment-resistant depression. I had really wanted to be a therapist and spent a lot of time working like one-on-one with people, again, like drawn to like I
Yeah.
need to help people through a crisis. And then very quickly start to realize, like the system is kind of broken. We need to
Yes.
go from like the micro to the macro.
Hmm.
And I switched to basically getting my master's in international public health and gender studies here in Berlin in Germany.
Mm.
And then, from there, really started to work in healthcare policy and very large scale health system transformation.
Wow.
So in New York or in the US, I was working with the New York State Department of Health on the very large Medicaid reform in terms of basically moving New York
Mm.
State to value-based payment and redesigning the care delivery system.
Hmm.
I worked with CMS for a long time, and then I started to work in the Middle East as well, doing very large health system transformations with countries like Bahrain and Saudi and the UAE. So basically, it's been a long journey, but I have seen the sort of healthcare from lots of different places.
You have.
And the reason why I start off with kind of that where I'm from being very complicated is in all of these pieces and all of these points in like my healthcare journey, I've realized that, having someone give you the information that you need to take an appropriate sort of decision is so, so crucial.
Well, I think that's probably the one of the most Starwolf challenges in certainly in the US healthcare system. I know I talk to my public health students about this all the time. There's such a void of actionable
Mhm.
information, right? And
Yes.
information that's contextual and when you need it and how can you make effective decisions when that information isn't available to you at the time when you most critically need it?
Yeah,
Um,
exactly.
I love your sort of, gosh, you've worked across the US, Europe, Africa, the Middle East, right? There's so many diverse geographies and healthcare systems that you've been exposed to. Do you feel that really kind of gives you, I have to think the answer is yes, but, kind of gives you a very sort of unique perspective in the work that you do at Ada Health? And we should probably get into what Ada Health is, but how much is that how much of that diversity is sort of informing even your day-to-day work, Shireen?
Yeah, definitely. I think, the exposure to all of these different health systems from both a professional standpoint, but also from a personal standpoint, I'm sure we'll get into that as well, has been really fascinating, right? I mean, I have
Mm.
um, sort of had this question going on in my brain for the last 15 plus years of working in healthcare, which I think a lot of people who work in the industry ask themselves is, which country really has the best
Best. Sure.
care
Yeah.
system, right? And you can sort of analyze it from the reimbursement model and like the nurse to patient ratio and all of that, but ultimately it's really like it goes back to what we are talking about now, right? Is
Right.
does everyone have the information that they need to make
Hmm.
appropriate healthcare decisions?
Right.
And that's really what drew me to Ada.
Mhm.
So Ada is, a symptom assessment care navigation platform. We are a certified Class 2A medical device in Europe. Ada is available in almost 150 countries, and Ada is always free to the
Mm.
end user, which
Yes.
is absolutely amazing and so important to me. And we're able to also do that because we have enterprise partnerships that allow us to further scale Ada's reach by working with, pharma and health systems and governments. And we've done that across, several continents as well.
Mm. Mm.
And what ADA's really focused on doing is, of course, assessing your symptoms if you're not feeling well, but then telling you, okay, this is what you can now do about it. Here's the type of doctor you can see. Here are the type of tests that you would need to get a formal diagnosis. Here are, let's say, over-the-counter products you can look at. Here's
Mm.
where you could find a pharmacy near you. Here's a link for a telehealth provider so you can have something delivered to your home. So, that is the kind of thing that we've been able to spread to almost 150 countries. And I think that gets me super, super charged and excited.
And I can attest to what you offer is real and works. When you and I first met, I went and said, I'm going to try this out for myself.
Yeah.
So I went to Ada Health and I did some assessments based on, what you had offered there. And it works. I mean, everything that you just said about what the assessments provide you in terms of actionable next steps, it's all there. And it's
Yeah.
very impressive. And, I didn't obviously know the depth and the reach of the partnerships and other things that you have, which I'm sure is incredibly important. But I can attest that what you have does work and is providing a very valuable service for folks. So thank you for doing that.
Yeah, definitely. I think the cool thing about Ada is that it was actually built by clinicians.
Mm-hmm.
And so our founder and our chief medical officer, Claire Noverall, she's actually a pediatrician from the NHS.
Mm.
And, she, alongside with our CEO, founded Ada because she had seen these kind of problems firsthand in her practice.
Yeah.
And I think the fact that Ada has, it's built by clinicians, but for patients, you've really sort of got the major players involved and sort of kept front and center in this solution, right? And,
Right.
a lot of people ask, well, is Ada or is AI going to replace doctors? The sort of like question everyone's like freaking out about.
Cautionary tales. Yeah.
Yeah, exactly. Like everyone's freaking out about it. We're not. We're like, no, actually, Ada's amazing
Yeah.
for patients and for doctors
Sure.
because basically what it allows you to do is give the patient the information that they need. And Ada does that in a very kind of like white box explainable way, which is very different than, the LLMs that run on their own, which are completely black box.
Right. You have no idea where the information is coming from,
You have
how
no
it's
idea.
sourced. Yep. Mm-hmm.
Yeah, where it's coming from and also how it reached the conclusion that it reached.
Right.
Whereas Ada, if you check out the assessment report that it generates at the end of, asking you all those questions, Ada will, in a very transparent way, show you everything that you reported summarized into present and absent symptoms.
Nice.
And then through what we call explainability lines, basically draw connections between what you reported and the symptoms that are typical of the conditions that are suggested. And then, you as a patient can take that to your doctor and use it to jog your own memory or talk about specific symptoms and ask your doctor about them. And, for people who are also, have been in this diagnostic odyssey for 5 to 10 years, which is very typical of, let's say, a lot of rare diseases. I mean, this kind of making connections between the dots and like narrowing the conversation for the clinician
So
is
helpful.
so helpful.
So helpful. Yeah. Yeah. As someone who's gone into a physician's office with notes typed on my phone, right, to jog my own memory, to your point, Shireen, of like, oh, before I go, I just want to ask you about this one thing or
Exactly.
the other thing, right? Um, and the other concept that you sort of mentioned about AI, I sit on a large public health technology steering committee here at the University of Massachusetts, and you can imagine we spend a lot of time talking about the association between clinicians and AI,
Mhm.
and to what you just said, there's so much more opportunity for real transformation than there is for sort of a little bit of this fear of replacement or things that just aren't practical,
Absolutely.
right? Yeah, absolutely. Like so many individuals, Shireen, who are dedicated to healthcare innovation and healthcare transformation, your dedication does come from a very personal place. You struggled with undiagnosed endometriosis for a while, right? A lot of women are suffer from endometriosis or other women's health issues that I still believe in. I'm not a woman, obviously, but I still believe in so much of it comes from stigma associated with these
Mhm.
things that we still just don't feel comfortable as a society really talking about women's
Yeah.
health. Would you talk to us a little bit, Shireen, about your experience working through an undiagnosed issue that is as impactful as endometriosis?
Yeah, definitely. This conversation is so important to me because I feel like, hearing other people talking about their endometriosis journey was actually, one of the most important
Mm.
parts of my own journey and sort of helping me take action. And I think every time someone has a conversation like this, I'm convinced it helps one person directly or indirectly because they tell their friend or their
Right,
friend's friend.
right, right.
Um, yeah, so maybe going back like 15, 20 years, I from when I was a teenager, and
Mm.
I'll just be super direct here.
Yeah, it's okay. Yeah.
I experienced very heavy menstrual bleeding
Mm.
and menstrual cycles that went on for 2 weeks.
Wow.
And over time, when I was sort of in my like mid to late teens, it was so painful and so
Mm.
debilitating. I would have horrendous stomach aches that would then sort of shoot up the back of my spine,
Wow.
and then also send shooting pain down my legs. It would
Mm.
feel like I would have very different kinds of pain. So I would have pain that felt like someone was sort of squeezing
Oh,
my ovaries.
yeah.
But then in combination with that shooting pain, there was also sort of this dull pain around like my entire
Oh my
pelvic
gosh.
and lower back
Just to
area.
round everything out for you, right?
Yeah, all the kinds, all the kinds.
Definitely this acute excruciating pain combined with this dull pain that's constant, right? Yeah.
Yeah,
Uh,
absolutely. And
yeah.
it felt like, there was a hot knife or like nails
Oh,
scratching at my inner organs so
yeah,
much of
sure.
the time.
Yeah.
And, I think I mentioned, early in our conversation that I've personally experienced health systems around the world
Right.
because
In so
between,
many countries. Yeah. Yeah.
yeah, because between Milan, New York, Berlin, and Delhi, I had seen every kind of doctor, right? And I think the interesting thing about endometriosis is you've got things like stomach pain, you've got heavy menstrual bleeding, you've got long periods, you've got pain during sex, you've got
Yeah.
so many different things that if you were to take each symptom in isolation, it can send you down a
So
completely different
so
clinical
many different paths, right? Because
path.
they all don't appear to be interrelated, but they may be.
Exactly.
Yeah, and right. So you start exploring the heavy flow, or you start exploring the pain, or you start. And I understand how it can be a siloed sort of reaction.
Exactly. And
Yeah.
so, so this had been going on and on for years. And I remember going to a doctor who was like, you should just switch your diet to black coffee and burnt toast for a couple of weeks and see how that pans out. And then I would have other doctors who would say, well, you should just take prescription painkillers for 5 days because your body's just probably used to being in pain and you need to just cut the cycle of pain. By the way, like you're in your mid 30s. Are you thinking about having
Having
kids? Because
children.
when
Yeah.
you get pregnant, then, endometriosis typically goes away.
Hmm.
So, there
Except
was
that it's a huge barrier to getting pregnant.
exactly. So, I mean, that's like the nature of the conversation. So
I'm still like
often.
stuck on the take a bunch of prescription painkillers advice.
I know, I know. To be honest, I can't decide if that's worse or the burnt toast and black coffee. I'm like,
Yeah,
I
well,
don't
I
know.
guess you can't get addicted to maybe you can, but you can't.
You're right.
It's
You're
less likely to
right.
get.
You're right. So, I mean, there were like 15, 20 years of just experimenting and experimenting. And
Sure.
I was having horrible vertigo that was potentially related to hormones. So I went to see an ENT and I had a hip problem. So
Mm.
I went to go see a physiotherapist
Were you
and
seeing like endocrinologists too at this time,
yeah, I was
Shireen?
seeing
Yeah,
endocrinologist.
yeah, yeah.
Because of my stomach pain, I saw a gastroenterologist and
Right.
I
Yeah,
also saw an OBGYN. So I had seen every kind of doctor, gotten every kind of test.
yeah.
And then at one point in my sort of consulting days, I was working in a very high stress situation where I was just traveling for weeks at a time to the Middle East and then
Mm.
coming back home. This was right before the pandemic. Felt like I was working 24/7. And endometriosis, because it's an inflammatory condition, I think
Right.
that was basically what just tipped it over the edge. And I just hit this wall where I couldn't get out of bed, and the
Oh,
pain had just bumped up to this excruciating
yeah.
level.
10 out of 10, right? Yeah.
10 out of
Yeah.
10.
Yeah.
And I was on medical leave for about a month and a half. And at
Wow.
this point, I still had like no idea what
No
it was.
idea what was going on. Yeah.
No one knew
Yeah.
what was going on.
Yeah.
I went to the best hospital here in Berlin as well. And, I shared all of my symptoms, and they were like, wow, this is so fascinating. To be honest, I don't know what's going on with you, but whenever you figure it out, I'd love to know, because this is a really fascinating
Can you
case.
fill us in?
I was like, cool. I'll do that.
Yeah, great. Yeah, you'll be the first people I call. Yeah.
So, and then I started to, talk to my best friend's friend who had endometriosis, and she was sort of like floating this idea to me, because my PCP was like, I don't know what's wrong with you. This is potentially what it is.
Sure.
And a lot of the symptoms seemed to be adding up, but I heard that you had to get a laparoscopy, which is like a surgical procedure to actually get it diagnosed.
To accurately, so they have to go and do a laparoscopic procedure into into your
general
uterus.
Anesthesia, the whole thing.
Mm-hmm.
And I was like, it was during the pandemic, and I was like, I'm not, like, no one's convinced about this. Like, I don't think I want to
in
go.
elective, I don't know what it was like in Germany, but certainly elective procedures like that here in the US were completely just halted, right?
Exactly. Yeah. And so that was also an issue for a long time. And then, I had started working at Ada in August 2021. Mm-hmm. And so, like, again, like, years had already then gone by, but August 2021. And then about a month into working at Ada, I was preparing to demo the Ada solution for a client. And I was just sort of like practicing on my phone, like what I would be showing the client live. And I was having a crazy pain day. And I was like, I'm just going to enter my own symptoms for fun.
Yeah. Yeah.
And Ada, basically prompts you with a series of, medically relevant questions. And you basically just answer yes, no, or I don't know. It's really intuitive. If you don't know, what Ada is asking you, there's like a button that says like, what does that mean? And it'll explain.
Little info. I saw that. Yeah.
And so I filled, I started punching things in and finished the assessment like 2.5 minutes later. And the first suggestion is endometriosis. 9 out of 10 people with the symptoms you've reported have this condition.
It's pretty high rate.
Pretty high rate, and number one suggested condition. And I just burst out crying.
Of course.
And I was like,
you must have felt like tremendous relief and frustration, and I can't imagine the collision of so many emotions at that point.
Yeah, absolutely. And so it really just hit me like this must be it. And then Ada tells you how you get a confirmatory diagnosis, and like we talked about, one of those things is laparoscopy. And so 2 months later, I was scheduled in for surgery.
For the lap,
And for the laparoscopy.
Yeah.
And then I'm like coming out of anesthesia, and like things are making sense again. And the doctor comes to me and is like, okay, I have your results, and you have like pretty severe endometriosis all over your organs, your intestines, and your ovaries have been fused together on the left side. Goodness. And you have adenomyosis as well, which is basically the same thing is happening sort of, in the uterus.
In your uterus as well as your ovaries. Yeah. Yeah.
Right. And, we can see that because your uterus is much larger. Mm-hmm. And again, I just, burst out crying, and I was like, what? Not crazy,
No. Yeah. So again, the collision of like worst case news you could have gotten, but now you do have an answer at the same time. Right. So God, what a volley of emotion. Yeah.
Yeah. That's exactly it. I mean, so many people had told me that, it just, that's definitely not, my own gynecologist said, you definitely do not have endometriosis. Like she said that so explicitly to me. And she had also looked for endometriosis through an ultrasound.
Okay.
And, right. And like what Ada also tells you is like, you can only diagnose if you get a laparoscopy. And so, all of this is just to say, I mean, in the classic, most cliche form, information is power, right?
Mm-hmm.
And those
Yep.
15 to 20 years of being gaslit by all
Ugh.
parts of, all parts of life.
Almost the entire medical community.
But also, like, honestly, like, also some friends and
Oh,
family,
sure. They're
like,
just like, oh, so you have like hard periods. Like, who doesn't? Like, yeah,
exactly.
yeah, yeah,
There was a
yeah,
lot of,
yeah.
interestingly, like, there was a lot of this runs in our family
Mm,
conversation, which,
mm.
we also know that now we know that,
Sure.
like, endometriosis also, if you have endometriosis, the likelihood that your kid has endometriosis is higher. So
Of course.
we know all those things now.
Right.
But there was a lot of, like, in our family, we have heavy periods, we have painful periods. Like, your
Yeah.
grandmother used to
You did, your
faint.
mom did, your sister does,
Yeah,
whatever. Yeah. So this is
yeah,
just the way it's going to be. Yeah.
exactly,
Yeah.
exactly.
Remarkable. Shireen, thank you for sharing your diagnostic journey with us. And I know, as we talked about, how pivotal it is to your own work in healthcare transformation and the work that you're doing as a healthcare leader and a patient advocate. And so much of what ADA stands for as it pertains to system redesign. So thank you for sharing that.
Yeah,
Can I
thank you.
ask how are you feeling now? How are you doing?
Yeah, so I mean that's kind of another interesting part of the whole story is, um so I'm doing much better, I would
Hmm.
say.
Sure.
I won't say I'm
Sounds like it's
doing.
still a journey. It's still a
Yeah,
journey, right?
it's
Yeah.
still a journey.
Yep.
It's a chronic condition that
Right.
has no
Right. Right.
treatment,
It's not going to go away like a cold.
right?
Right. Yeah. Yeah.
Right. Um, I've become very, very good about being in tune with my body. Like,
Sure.
now, I used to be completely unaware
Mm.
about, what it was that I was doing that was affecting my body, like certain things I was eating or how much I was sleeping or if I was drinking water or drinking too much wine. Like, I had no idea. I was just doing whatever. And I've become so much more aware of that now. But interestingly, I think, you know, what we've been talking about a lot is sort of this long diagnostic journey that so many people go through that's very windy.
Right.
Um, but I think the other side of this conversation is, when you go for long periods of time undiagnosed, then what that often means is your symptoms are worsening,
Right.
and they're, for conditions, just generally speaking, I mean, your symptoms are worsening, and then you're losing precious time that you could have been on
Sure.
treatment or adjusting your
Sure.
lifestyle or whatever it is.
Or I think about the child aspect, right?
Yes,
If you decide you want to have children,
exactly.
there's that pressure, that additional pressure as well, right?
Exactly,
Yeah.
exactly. Like,
Hmm.
just so many important choices
Hmm.
that you then make, right?
Right.
And um the thing with having such a delayed diagnosis was that I had been on birth control the entire time that had
Mm.
estrogen in it.
Hmm.
And, then found out, okay, well, you've got endometriosis. You're actually not supposed to
Yeah.
be.
It's counterindicated. Yeah.
It's
Yeah.
contraindicated.
Yeah.
And
Yeah.
so, this whole time I'm on the wrong medication because I had been undiagnosed,
Hmm.
and not only the wrong medication, but as you said, a contraindicated
Right.
medication.
Yeah.
And so, then after the diagnosis, I was put on a birth control that didn't have estrogen anymore. But, obviously that's not the
That's
way
not
that
a
I think about.
magic bullet. Yeah. That's not a,
Yeah,
yeah. Yeah.
it like
Yeah.
wasn't great. But, like,
Right.
then, you start to think about, if at ADA, we specialized a lot in, like, rare and complex disease, for example.
Yes.
And
Yes. Yes.
we've got like
Or
30,000.
underdiagnosed diseases too, right?
Exactly.
Yeah. Yeah.
Underdiagnosed,
Yeah.
overlooked,
Mhm.
misdiagnosed, complex. And, we've got 30,500 ICD-10 codes that we cover in our medical engine.
Wow.
It's because of that breadth, but also the depth that we go into with our questions, that we're able to be so accurate. But
Right.
when you start to think about, what I just said for endometriosis in the context of rare disease, I mean, we hear stories all the time about people who went undiagnosed for 5 to 10 years that, because of that, went through wrong procedures,
Hmm.
multiple surgeries they shouldn't have gotten, wrong
Hmm.
medications.
Hmm.
They've maybe got some life-threatening conditions, so they're losing precious time
Right.
in their lifespan by not being on the right medication, right? And so a lot of the work that we do at ADA through our partnerships with life sciences, for example, are not just accelerating the time to diagnosis, but making sure that people actually get matched to the right treatment,
Mm.
like as soon as possible,
Yeah,
right?
more accurately and more quickly, right? Yeah.
Exactly,
Yeah.
exactly. More accurately and more quickly. And you think about other conditions like MS, where, when there's a first episode that happens, like what doctors will say is the first thing we need to do is get your condition under control and like put you on treatment, right?
Sure.
And every minute wasted is
Mhm.
can be detrimental, right?
I had been following your career, Shireen, most recently, as we were getting ready for our conversation together. And, congratulations on your appointment to the executive leadership team at Ada Health. And, one of the main tenets of this platform and its conversations is around women in leadership positions.
Mhm,
And
mhm,
I think right now about your personal journey and so many things that you were dealing with as a woman, and your endometriosis, and at the same time you're continuing to drive your career forward, continuing your work in healthcare transformation and patient advocacy and payment reform. As a woman leader now in healthcare and technology, did you feel, that you were supported through that? And, what do you think are some of the essential ways that we need to create more inclusive leadership paths for individuals like you through our industry?
Yeah, I always love this question because I mean, I always feel so lucky when I answer this question because I've I've been really, really lucky with the bosses that I've had through my
Yeah.
career. I mean, sometimes I think about it and I'm just like, how did I get so lucky?
Yeah.
In the sense that you know, I always had really powerful female bosses,
Hmm.
and like the kind of powerful that, they walk into a room and they command attention, and um
I like that. Yeah.
yeah,
Yeah.
I love that kind of aura, and I'm drawn
Yeah.
to that kind of aura. And I always had female bosses that challenged me
Hmm.
and really pushed me way beyond my comfort zone, like saw things in me that I didn't see in myself. And I remember in my early 20s having very formative conversations about, I don't think I can do this. Like, I don't think I can give this talk in front of 200 senior
Sure.
physicians,
Yeah.
and
Overwhelming. Yeah. Yeah.
overwhelming, like complete self-doubt, imposter syndrome, the whole,
Mhm.
usual situation.
Right.
And they'd be like, no,
No, you
you
can do it.
can't.
Yeah.
You can do it. I know
Yeah.
you can do it. And that's why I'm putting you there,
Lifting you up. Yeah.
lifting you up.
Yeah.
And I just back to back had bosses like that. And now at Ada, I first used to report to our former COO, who absolutely fits the description that I just shared. And now I report, directly to Daniel, who is our CEO at
CEO.
Ada. And, it's so important to have, I mean, it's a bit of a cliche, right? Everyone has said it, but it's so important to have those male champions,
Hmm.
right? As the chief of staff to Daniel, I get to be sort of his right hand.
I was
And
gonna say, yeah,
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 and
you're in it. Yeah. Yeah.
I'm
Yeah.
in it.
Yeah.
And I think that only works if you've got someone who really believes in
Mhm.
female leadership, right? And really believes in bringing, creating a leadership team with the strongest
Mhm.
possible people for, what you want to commercially
Accomplish. Yeah.
achieve,
Hmm.
but also what you want to achieve internally in terms of, motivating, inspiring, and driving people.
Sure.
And
What's
it's
I look at it as is, what's the ethos of the company, right?
Mhm.
And
Yeah,
the culture and what the
absolutely.
company wants to do. And if, it sounds like what Daniel and others, yourself included at the organization, are creating an ethos of the company where there's room and you recognize the need to have the right people at the table, right?
Yeah, I
Yeah.
think, it's kind of interesting having gone from consulting to a world like Ada, where it kind of felt like in consulting, because everyone is a consultant, you're all sort of competing against each other in this like sort of weird way. You're like, you're my colleague, but also don't touch my client.
Right, exactly.
And then, but at Ada, I think we've just done a really awesome job at bringing kind of expertise from lots of different corners and then forming these like power teams.
Sure.
And I think there's a lot of awareness for, like this person in the leadership team or this person in the product team, like they have these specific strengths.
Mm-hmm.
And then that other person has these other strengths. And how are we going to form a power team that is convincing to, our end users or clinicians or life sciences companies? And I think we've done a really good job at that. And I realize that I love that way of working. And the colleagues as competitors all the time got a little bit tired.
Got a little old, yeah. Well, and I think too about what you just said about the types of clients that you have, right? These are extremely high knowledge clients that need to understand and feel very confident in the teams that they're working with. And I'm sure you bring a lot of that to the table, Shireen.
Yeah, I mean, for example, I think what's really awesome, right, is just to go back also to your earlier question, is how do you actually, create these spaces where you can, how can you actually create this kind of space? And I think it's, so incredibly important that, Daniel, as our CEO, has said to the company, like, women's health is a priority for us, right? And women's health is not just reproductive health. It's much more than that, right? It's
total. Yeah.
Autoimmune conditions where women are much more, presented, disproportionately presented, and cardiovascular conditions where women's, initial presentation is very different than the classical male presentation that is studied. And I think that kind of direction coming from the leadership it's crucial, right? And, for that reason, then on the other side, we've been able to have these awesome partnerships that are really close to my heart, like the one that we have with Bayer Consumer Health on women's intimate health, where you've got conditions like bacterial vaginosis, vaginal thrush, and like a lot of these conditions where there's so much fear and stigma about, imagine, I always like to say, like, imagine going to a pharmacy where you've got a line of people behind you. Like, are you really going to talk about the color of your changing discharge? Like,
of your vaginal discharge. Yeah, it's a little bit off-putting. Yeah.
Probably not, right? So, I mean, it's awesome because what we've done is, we've embedded Ada into the Bayer environment, and, women who feel like they have symptoms can, go to Ada. It's completely confidential.
Right.
They can input their symptoms, and then Ada can tell them which, over-the-counter medications, are available to them, and they can just order them online. And, we've had like 500,000 women who've taken these assessments and actually use this, right? And I think like those kind of integrations that we have at Ada, I think have been really meaningful for people to see, right? And I think in a similar vein, we've had this incredible partnership with the South African Department of Health.
Oh, wow.
In partnership with Reach, basically to integrate Ada into WhatsApp.
Oh, cool.
And have, mothers around the country.
Yeah, now you've got huge extension of your,
and like, outside of the US, like everybody's lives run on WhatsApp.
Right? Sure. So,
so you can imagine that, we had embedded Ada into WhatsApp, and now you have these moms who are using this Mom Connect platform for a number of different issues already, now able to ask questions about their own health or their infant's health, and sort of get answers and guidance based on that. And we found a 90% reduction in women not knowing what to do before and after Ada, which is just crazy.
That's outstanding. Yeah, that's outstanding. What a great metric for you guys to be, being able to report, and an improvement in outcome as well. right?
Yeah,
Yeah, that's
absolutely.
outstanding. Shireen, you've been great. And thank you. And I before we let you go, I do have one last question for
Yeah.
you. You have so many aspirations for Ada Health and what it can do to really impact global healthcare systems. I mean, even the example that you just gave with the WhatsApp integration is a really powerful example of how Ada can impact global health. But Shireen, what role do you envision yourself playing in sort of achieving that vision?
Oh, that's a great question. I've always sort of had this kind of like lifelong dream of, maybe this goes a little bit like full circle to where we started, of
Yeah.
just taking the best of every healthcare system that I've encountered and, putting the pieces together to the most ideal solution, right? And
Hmm.
then just absolutely scaling that, right? There are parts of the US healthcare system that are just so incredible, and
Yeah.
parts of the German system that I'm so lucky to, have health
Experience.
insurance
Yeah.
within.
Yeah.
But I feel like, because I've experienced it from both a personal and a professional perspective, it's kind of been my lifelong calling to be like, one day we're just gonna piece all the best practices together. And I think I definitely feel like I'm in the right place right now to have started that
I love it.
journey.
That's amazing. We've been speaking with Shireen Saxena, the VP of External Affairs and Chief of Staff at Ada Health. Shireen, thank you for taking the time to chat with us and telling us your very personal journey and all the amazing work that you're doing around healthcare system redesign and all of the great work that Ada Health is doing. And thanks again for your time.
Thank you, Richard. This was really fun for me. So really appreciate you having me.
You're welcome.